A case study titled Chronic Stimulant Use, an upcoming cause of neurocognitive disorder in later life, conducted by Jacobs et al. 2016, tackles the later effects of prolonged stimulant use that might result in a major neurocognitive disorder. The case study focuses on the 58-year-old woman with a history of chronic daily stimulant use who was diagnosed with a major neurocognitive disorder, psychotic episodes, and behavioral problems. It was shown that the woman has prolonged exposure and usage of stimulant drugs for more than 30 years, specifically cocaine, amphetamine, and nicotine. She also suffered psychotic episodes at the age of 23 after the death of the child, worked in prostitution, and had been always to take care of herself and her daughter. The prevalence of illicit substance use among older adults is rising, creating greater risk because of age-related changes in drug metabolism and neurotransmitter systems mediating drug effects in the brain. The long-term effects of prolonged substance use might cause severe cognitive disorders. The study stated that cocaine abuse might suppress normal brain development in adults, primarily the frontal lobe and temporal lobe, which can lead to cognitive corruption. According to the study of influence of drugs in cognitive functions 2017, substance abuse and misuse can cause the brain plasticity mechanisms that may produce lifetime changes in neural circuitry, especially behavior, and it heavily influences the cognitive and mental health of a person. It can affect a person such as learning, memory processes, motor skills, and abilities that lead to significant interference of a person's daily livelihood. Using stimulant drugs in the wrong way, misuse and abuse can lead to detrimental results and produce neurocognitive disorders.
Magandang araw! Ako si Christian Ace de Jesus Lorenzo, first year psychology student. Ang topic na napunta sa aking grupo ay ito: chronic stimulant use, an upcoming cause of neurocognitive disorder in later life. Ngayon, aking ipapaliwanag ang objectives ng chronic stimulant use. Ayon sa pag-aaral, ang objective ng chronic stimulant use ay ito: alert for chronic stimulant use as etiological factor for neurocognitive disorder. Puntahan natin at ipaliwanag ang mga terminologies na ginamit sa objectives. Una, yung tinatawag nating stimulant. Ang stimulant ay isang uri ng droga na nagpapabilis ng pagdala ng mensahe sa utak at katawan ng isang tao. May iba't ibang uri ng stimulant tulad ng cocaine, nicotine, caffeine, amphetamines. Ang etiology naman, ito yung origin and development of disease. Yung pinagmulan ng sakit, ito yung maaring psychological disorder or mental disorder. May tinatawag din na psychological etiology, the scientific study of origin of disease. Akin na may papaliwanag ang neurocognitive disorder. Ayon sa Diagnostic and Statistical Manual of Mental Disorder, DSM-5, ang neurocognitive disorder ay nahati sa tatlo. Una, ang delirium. Pangalawa, ang mild neurocognitive disorder. At major neurocognitive disorder. Maraming salamat sa pakikinig.
Upon admission, the patient underwent physical and neurological examination that revealed no abnormalities. But the patient's psychiatric examination showed auditory hallucination and paranoid delusions. Meanwhile, all the hematological routine and biochemical tests were normal, and the urinary drug screening for cocaine, amphetamine, and tetrahydrocannabinol were negative. The patient was then admitted to an adult psychiatric ward and was treated with risperidone for her psychotic symptoms. When these symptoms subsided, the treatment was gradually reduced and later on was stopped completely. However, significant memory impairment and issues with organization and planning was observed with the patient, and further psychiatric assessment was performed. Through the assessment, the patient was observed to display rapid psychomotor activity and that the patient's attention can be easily drawn and was hard to keep with any particular subject. Furthermore, hypervigilance was observed with the patient as she was very reactive to any stimulus. The patient also appeared to be disoriented and displayed disruption in both long and short-term memory, and as well as confabulation. Frequent repetitive behavior and perseveration in speech was observed, and her thought process appeared to be affected. However, there were no observed hallucinations or delusions. Additional examination was performed on the patient in the means of comprehensive neuropsychological investigation. And through this neuropsychological test, it shows the patient's deficit in memory, executive function, information processing speed, and visuospatial ability. To examine the underlying etiology of the documented cognitive impairment, additional examination was undertaken. Cerebral MRI revealed the confluent subcortical and periventricular white matter lesions as well as dilated ventricles, and carotid ultrasonography imaging, it reveals no evidence of atherosclerosis. Serology for HIV, syphilis, hepatitis, borreliosis, and paraneoplastic antibodies revealed no abnormalities.
A 50-year-old woman with a history of chronic daily stimulant use, primary cocaine, amphetamine, and nicotine for 30 years, have negative effects because those kind of drugs speed up messages traveling between brain and our body. Like what her daughter discovered when she noticed progressive memory problems and behavioral changes with self-neglect in the patient. Her mother began to live more isolated and even barricade her house a few months before admission. She didn't trust anyone and appeared to be hallucinating. There were also some episodes of aggression towards neighbors. The person suffering from symptoms of overstimulation can cause anxiety, panic, seizures, headaches, stomach cramps, aggression, and paranoia. After psychotic symptoms were treated, severe cognitive impaired with behavioral problems persisted. Based on the findings of neuropsychological investigation, her decreased independence in daily life, a major cognitive disorder with behavioral issue, was diagnosed.
Given all the background, objectives, methods, and should that lead to the conclusion of the study, chronic daily stimulant use, the shown case study focused on 58-year-old woman with a history that connected to chronic daily stimulant use, which one of is the neurocognitive disorder. This study, based on diagnosing, it come up with three, which is delirium, mild, and major neurocognitive disorder. The prevalence of this illicit stimulant use should be considered as it creates greater risk and possible etiological factors or the origin of disease. An examination was performed on patient by means of comprehensive neuropsychological investigation of the underlying etiology. The stimulant is kind of drug-like cocaine, nicotine, pematin, and others. And to include that, it says a person suffers from symptoms of overstimulation, the cause of anxiety, panic, headache, aggression, paranoia, and others. A stimulant is kind of drug that makes a person deliver message faster throughout the brain and body. This case highlights the possibility of chronic daily stimulant use. For further information, you may proceed reading the study.
Because drug use in youth has been found to be significantly greater in the baby boom generation than in earlier cohort. The prevalence of illicit substance use among older persons is increasing, in part as a result of baby boom generation's aging, because of age-related changes in drug metabolism and neurotransmitter systems that mediate drug effects in the brain. This is likely to be accomplished by increasing dangers for older adults. Additionally, there may be a rise in the frequency of long-term effects of substance use, like cognitive impairments. There is a lot of evidence linking long-term substance, especially cocaine usage, to cognitive decline. The majority of studies on the effects of persistent stimulant usage on cognition have a short follow-up period. As far as we are aware, persistent stimulant usage has not yet been linked to irreversible cognitive impairments. The most recent version of the Diagnostic and Statistical Manual of Mental Disorders defines a significant neurocognitive disorder as an acquired cognitive loss in one or more cognitive domains that materially impairs a person's capacity for daily independence.
This case highlights the possibility of chronic daily stimulant use, resulting in a major neurocognitive disorders. Since the prevalence of the long-lasting illicit stimulant use among older adults is rising, we suggest considering this is a possible etiological factor of neurocognitive disorders. Propose to enroll to the sites that will treat patients with amphetamine use disorders and sites that will treat patients with cocaine use disorder. Treatment protocol will include a supervised administration of a prescription psychostimulant medication given in combination with a psychosocial intervention. Propose a trial of a extended release preparation of mixed amphetamine salts for patients with cocaine use disorders and extended release methylphenidate for patients with amphetamine use disorder. The psychosocial intervention will follow a manualized program that includes elements of MET, MI, CBT, CM, and psychoeducation. We propose a 6-month-long trial with the primary outcome of a sustained abstinence from illicit stimulants.